Hello, everyone. So today I want to talk a little bit about AI and how I think AI could affect medical field and physicians and doctors as a job. I think this will be a rather lengthy discussion, so I divided this into two parts. On part one video, I'll be talking about the current application of the technology and where I see it going in the future. On part two video, which will be uploaded later, I want to talk a little bit more about what I think are roadblocks to AI completely replacing doctors and what I think would be good or bad about AI replacing doctors. I then plan to finish the part 2 video with a word for students who are interested in going into medical school but who may be worried about this whole AI issue. In terms of current application of the technology in medical field, I'll be talking in depth about the field of radiology, largely because that's my field of practice and I have firsthand experience, but also because I think radiology would probably be most heavily impacted by AI of all medical fields. Let me briefly explain our work as radiologists because I think this may help better understand AI's current role in our field. The first part of our work is detecting abnormalities in the images, basically determining what we think is normal versus abnormal on images obtained. The second part then is to interpret, trying to make sense of abnormal findings and solve the puzzle. By this stage, we typically have some diagnosis in our minds and have some idea of the big picture of what we think is going on with the patient. The last part of our work is to communicate our thoughts via a report. Our report typically contains a lengthy section that details all the abnormal findings we detected, and a shorter impression section where we would deliver our punchline or summary of what we think. Currently, AI is being used in several ways to help us in this first step of image detection. One example will be in the case of large brain bleed. There's AI software that screens the scanned images on multiple patients. Simply put, it looks for large white stuff in patient's brain, which often signifies recent brain bleed. When AI detects such abnormality, it flags the case and prioritizes the case for a radiologist to review as soon as possible. Another way AI is being used is in cases of simple counting or detection. For example, certain types of breast cancers typically has calcifications. So AI can be utilized to detect bright calcium dots on images and mark them for radiologists. Similarly, AI is utilized in detecting nodules or counting certain lesions or abnormalities. AI is also being used for quantifiable data. In cases of dementia, AI is used to detect different lobes of the brain and to measure volumes of different parts of the brain. AI is then able to provide brain volume percentile matched for a patient's age. In cases of strokes, AI is able to analyze the conscious perfusion in the brain and quantify how large it suspects the stroke is in terms of milliliter. When it comes to interpreting step, where we make sense of abnormal findings, AI is not yet able to do this. Now, AI is able to do simple comparison when given quantifiable data. For example, if given MRI of the brain from 2 consecutive years, AI can compare measurements to determine if it thinks there has been more brain volume loss. But other than that, AI is currently not really being used to interpret or give a diagnosis. AI is starting to be used a little bit now in communication or reporting step, though not widely prevalent currently. Radiologists still dictate all the abnormal findings and put down the information. Then, AI software is now available that analyzes and organizes the information dictated by radiologists. I hear that AI is able to organize or structure the report and sometimes also able to provide a summary section. To help understand this a little bit better, imagine that you have to write an essay. You write out all your thoughts and arguments unorganized just as they cross your mind. Then AI comes after you, analyzing everything you wrote down, and it organizes all your ideas in an essay format: introduction, body paragraphs, and then conclusion. Now, AI is not quite that well developed yet and probably does not do this as well as you're imagining, but it could be thought of as a similar process, just more rudimentary at the current stage. So, how good is the AI technology currently? I think we're still in the early stages with lots of limitations. When AI analyzes images, it does not do well with artifacts. For example, if patient moved a little bit during imaging scan, creating a double image or blurry images, AI does not handle this well. I think AI is often useful when it comes to quantifiable data, as it is able to give volume measurements and percentile data. Even when dealing with quantifiable data, however, sometimes radiologists don't agree with AI's analysis. From my experience personally, it is a mixed result with current technology. Sometimes AI and I agree, sometimes AI is right and I'm wrong, and sometimes I think AI is wrong. If I had to give a rough example of what working with AI is like, let's consider if you and AI were looking at someone's pictures to determine if they had prior facial plastic surgery of any kind. AI would obviously be far better than you at picking up small differences in the pictures, but currently it is not able to differentiate between normal aging or makeup or even different lighting or true plastic surgery. So AI would mark all those perceived changes and show them to you. You would then make your final determination based on your own review of the pictures and also reviewing AI's marks. Currently, AI increases accuracy a little bit because we get AI's opinion in addition to our own usual review of the images. This added step of reviewing AI's opinion gives us an opportunity to check our work, but it does take additional time and decreases efficiency at the current stage. So where will AI take us next in the near future? I think the next big milestone change will be taking away as much of busy work from doctors, only really leaving the critical thinking part of the job duty for the doctors. In many ways, it will be like having a very smart resident physician working with you. For example, in radiology, AI would screen all the images as they are obtained. AI would have flagged or highlighted all the abnormal findings on the images before the doctor reviews the images. I imagine that radiologists will still be required to look at all the images themselves, but it would be like having an extra person reviewing the cases along with you. So this would make the work less stressful and would increase accuracy. If AI reaches a stage where it can auto-generate a report, then radiologists have potential to become significantly more efficient. Typically, generating a report takes as much time as reviewing images and solving the puzzle. So the better AI gets at auto-generating reports, the more efficient radiologists will become. If I had to imagine how AI could be useful to doctors in other fields in medicine, AI could be used to auto-message doctors when a patient has abnormal test result. AI may become able to automatically recommend next step of care or treatment. For example, if a patient has fever, AI may prompt doctors to order some additional tests, giving them a series of choices to choose from, such as blood culture, blood count, urine culture, or chest x-ray. Then doctors would just have to click and choose the option they want. In some sense, this could be like converting free response questions to multiple choice questions for doctors to answer. AI could also potentially be used to auto-generate patient encounter notes for medical records. What would it be like if doctors are completely replaced by AI? In radiology, I think there are certain aspects of my job that AI probably could do better than me. In the image detection step, I think AI has potential to be much faster and more accurate than human if the artifact issue can be worked out. It can be especially more accurate when it comes to what we call incidental findings. Most radiologists do very well in answering the main question that prompted the scan. For example, if the question was, does this patient have brain bleed? Or does this patient have pneumonia? Radiologists typically can answer these questions quite accurately. But there are cases where an abnormality just happens to be included in the images, often unrelated to current symptoms. For example, let's say a patient gets CT head with concern for a brain bleed, and there just happens to be a skin nodule around the ear that was imaged. This type of incidental finding usually poses a more of a problem for radiologists. Often these incidental findings are of no significant consequence to the patient, but rarely things like cancers can be incidentally imaged. AI would screen all the images equally rather than focusing on the main question or symptom at hand, and would probably find these incidental findings better than human doctors. When it comes to image interpretation, I think AI could become more accurate than human. By that, I do not mean that AI would give correct answer 100% of the time. I highly doubt that even AI will be able to do that. But what I mean by this is that AI will be able to provide percent likelihood since it can analyze far more data than a human being. For example, a human doctor will be able to say, this is most likely cancer. Infection is possible, but infection is felt much less likely. Whereas AI will be able to say, possibility of cancer is 88%, whereas possibility of infection is 10%, and so on. In terms of communication via reports, AI-generated report may or may not be more clear. Being able to provide more data and likelihood in numerical percentage certainly can make things more clear in some sense. However, in medical field, especially in radiology, there are many ways to express similar findings or ideas in words. Also, many radiologists tend to tailor their report style a bit depending on who the report is for. For example, if the report is for a surgeon who is planning a surgery for the patient, radiologists may focus on describing more about information that the surgeon might find useful, or choose to use words that would mean something to a surgeon. Whereas if the report is for a non-specialist doctor who is trying to determine the next best step or which specialist the patient should see next, radiologists would often focus on giving a more general idea of the diagnosis and which specialist typically handles such disease. I have a hard time imagining AI being able to tailor reports in various ways such as this. So my guess would be that AI will either generate a very detailed report or a very general report by default. In this regard, AI-generated reports may be very accurate, but those reading the reports may have a harder time understanding the non-tailored report. If all the doctors are replaced by AI, then it will be up to the patient to understand a bunch of medical language. As for the AI replacing doctors in other fields of medicine, I think the initial screening process can be easily replaced by AI. So the patient would talk with the AI about their illness. Vital signs like blood pressure and heart rate will be measured by the AI. AI may be designed to give a list of possible diagnoses or treatment options, or may be designed to provide one answer. I personally think that it would likely give a list of possibilities because I think medicine is more of an art than science a lot of times. And there's often not one correct answer. This is true in many steps, including diagnosing, considering tests to be done, and also even in treatment options. As you do with ChatGPT, sure, you could ask AI whatever question you may have about different choices, but ultimately, I suspect that the final medical decision will be up to the patient. To help better understand what the medical care could be like after AI replaces the doctors, let's consider a couple of imagined examples. Let's say you're going to the emergency department with belly pain. You're greeted by AI who will talk to you and ask you questions about your pain. AI takes your blood pressure, heart rate, and get blood work and analyzes all this. AI quickly turns back and says, these are your likely diagnoses. There is 50% chance that you have pancreatitis and 20% chance of viral enteritis, and so on as you see on that example table. AI then says, based on the data so far, 80% of the time the diagnosis could be made with CT abdomen and pelvis with IV contrast, but 10% of the time abdominal ultrasound also had to be performed on top of CT exam, and so on. AI then asks, which of these test options would you like to proceed with? Let's say you opted to get CT exam. After the CT scan, AI tells you based on the CT result, there is 95% chance that you have pancreatitis, and there is 1% chance that it could be cancer, and so on. AI says 99% of the time this is treated with being admitted into the hospital with IV fluids with no oral food intake. 1% of the time, if the symptoms are very mild, you can decide not to be admitted into the hospital. How do you want to proceed? Let's say you decide to be admitted into the hospital. AI keeps an eye on you and asks your permission for additional blood draw as the AI sees fit. At the time of discharge from the hospital, AI recommends that you get another CT scan in 3 months. After 3 months, you get your recommended CT scan. And then CT report shows 100% confidence that pancreatitis is now resolved or improved. The possibility of underlying cancer is now suspected at 0.01%. Statistically, no future imaging is recommended. Now, depending on the type of person you are, you may be completely fine with that result, or you may be left wondering what you are to do with that 0.01% possibility of cancer. Next example is a simple case of common cold. Let's say that you have cold-like symptoms and go to primary care AI. You talk to AI about your symptoms, and AI takes your blood pressure and whatnot. AI then says there is 50% chance that what you have is a cold. There is 20% chance that it is pneumonia, and so on. AI goes to say 30% of the time, all that was needed in cases like this is symptom relief type care and a follow-up visit. 15% of the time, antibiotics was needed, and so on. And then AI asks, which treatment or test would you like to receive? Of course, if you have questions, you can ask them, and AI would answer with more data and more percentage as you need them. For example, if you ask AI to pick one option for you, it may say let's say 80% of the people opted to get antibiotic treatment and chest x-ray to be on the safe side. This certainly is a viable option because risk of liver or kidney damage or allergic reaction from antibiotics is low at 0.01%. And chest x-ray is currently not definitively shown to increase chance of developing cancer. Again, depending on the type of person you are, you may be completely fine with that answer, or you may worry about these other risks and side effects mentioned. But you will likely have to make the final decision yourself, meaning that the burden of understanding the medical diagnoses, options, and risks and benefits may ultimately fall on the patient. That is all I have for part one of this topic. Thank you for your time. I'll see you with part two of the video soon.